Hello and welcome back to my channel. Today we're going to discuss Pityriasis rosea, a common skin condition that can cause concern due to its distinctive rash. While it can be alarming to see, Pityriasis rosea is usually harmless and self-limiting. We'll cover what it is, its symptoms, diagnosis, and management strategies to help you better understand this condition. Hi, I'm Dr. Knapp, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Pityriasis rosea is a skin disorder that typically presents as a widespread rash. The exact cause of pityriasis rosea is not known, but is believed to be related to a viral infection, possibly from the human herpes virus 6 or 7. This condition often occurs in young adults and teenagers, and is most commonly seen during the spring and fall seasons. Pityriasis rosea is not considered contagious, meaning it does not spread from person to person through direct contact. The condition usually begins with a single, large, oval-shaped patch called the Herald patch. This Herald patch often appears on the chest, abdomen, or back, and can be mistaken for ringworm due to its size and shape. The Herald patch is followed by a more extensive rash that spreads over the torso, arms, and legs. The rash is characterized by smaller pink or red scaly spots that tend to align along the lines of the skin, creating a pattern often described as the Christmas tree distribution on the back. The initial Herald patch is typically larger than the subsequent spots and may measure up to several centimeters in diameter. After a few days to a couple weeks, the secondary rash appears. The smaller spots are usually oval and can range from a few millimeters to a couple of centimeters in size. These spots often have a fine, scaly border and may be itchy, although the intensity of the itch can vary widely among individuals. Some people may experience only mild itching, while others may find it more bothersome, especially when their skin becomes warm or sweaty. In addition to the rash, some people with pityriasis rosea may experience other symptoms such as mild fever, headache, fatigue, or body aches, particularly before the rash appears. These systemic symptoms are usually mild and resolve on their own. It's also important to note that while the rash can look concerning, it typically does not cause any lasting damage to the skin and tends to fade without scarring. Diagnosing pityriasis rosea usually involves a physical examination and a review of your medical history. Your healthcare provider will look for the characteristic Herald patch and the subsequent rash with its distinctive distribution pattern. In most cases, the appearance of the rash is sufficient to make a diagnosis. However, if there is any doubt or if the rash does not follow the typical pattern, additional tests may be performed to rule out other conditions with similar presentations, such as fungal infections, eczema, psoriasis, or secondary syphilis. Your healthcare provider may perform a skin scraping or biopsy to examine the skin cells under a microscope. This can help rule out fungal infections or other skin conditions. Blood tests may also be ordered in some cases to exclude conditions like syphilis, especially if the rash has an atypical appearance. These diagnostic tests are generally straightforward and can provide valuable information to ensure an accurate diagnosis. I just want to take a moment to ask that you hit that like button, subscribe to my channel, and leave a comment below if you have any topics you want covered in future videos. Anyway, pityriasis rosea is a self-limiting condition, which means it usually resolves on its own without any treatment within 6 to 8 weeks. However, management focuses on alleviating symptoms and providing relief from itching or discomfort. Over-the-counter antihistamines such as diphenhydramine or loratadine can help reduce itching, especially at night. Topical corticosteroids such as hydrocortisone cream may also be recommended to reduce inflammation and soothe irritated skin. Applying calamine lotion or using oatmeal baths can provide additional relief from itching and help keep the skin moisturized. Keeping the skin moisturized is important, as dry skin can exacerbate itching and discomfort. Using fragrance-free, gentle moisturizers regularly can help maintain the skin's moisture barrier and reduce irritation. Avoiding hot showers or baths, which can dry out the skin further, is also advisable. Instead, opt for lukewarm water and gently pat the skin dry with a soft towel. Wearing loose-fitting, breathable clothing made from natural fibers, such as cotton, can help minimize skin irritation. Tight or synthetic clothing can trap heat and moisture against the skin, exacerbating itching and discomfort. It's also a good idea to avoid activities that cause excessive sweating, as sweat can irritate the rash and make itching worse. Keeping cool and using fans or air conditioning can help manage this aspect. In some cases, exposure to natural sunlight or artificial ultraviolet light therapy under the guidance of a healthcare provider may help speed up the resolution of the rash. However, it's important to balance this with the risk of sunburn and long-term skin damage from excessive sun exposure. If you choose to use sunlight as a treatment, ensure you use sunscreen on unaffected areas and limit exposure time. While Pityriasis rosea is generally harmless and resolves on its own, there are situations where you should seek medical attention. If you experience severe itching that does not respond to over-the-counter treatments, or if the rash spreads extensively and causes significant discomfort, consult your healthcare provider. Additionally, if you develop symptoms such as high fever, intense pain, or signs of infection such as increased redness, swelling, or pus, seek medical advice promptly. It's also important to consult a healthcare provider if you are pregnant and develop a rash similar to Pityriasis rosea. While the condition is usually not harmful, there is some evidence to suggest that it may be associated with an increased risk of complications during pregnancy. Your healthcare provider can provide appropriate guidance and monitoring in this situation. Complications from Pityriasis rosea are rare. Most people recover fully without any lasting effects. However, in some cases, the rash may cause temporary skin discoloration, particularly in individuals with darker skin tones. This discoloration usually fades over time and can be managed with moisturizing and gentle skincare. Recurrence of Pityriasis rosea is uncommon, but it can happen. If you experience a similar rash in the future, it's important to seek medical evaluation to confirm the diagnosis and rule out other conditions. Keeping a record of your symptoms and any potential triggers can help your healthcare provider provide better care and management if the condition recurs. Thank you for watching. As always, take care of yourself and make the most of your day.